Welcome back, guys, to the Lukin Center YouTube video channel. Thanks so much for joining again. Today, I'm very excited because we get to start a new series today, talking about group. As you've probably noticed, if you watch our other videos, mostly we talk about individual work. Last time, we talked a little bit more about couples work, but today we're shifting gears and starting to talk about group and why some individuals might be interested in something like that. Today, I have with me Jessica Collucci, who is our group specialist. So welcome, Jessica.
Thank you. Thanks for having me.
Sure, absolutely. So one of the first things I really want to jump in is kind of the difference between individual and group. Obviously, just from the word itself, one is individual,
Right.
the other one was lots of people. But maybe you can clarify, maybe expand on this difference so that some of the people who are watching can think it through and say, when I'm making a decision, am I doing one or the other? Or maybe I'm doing both.
Yeah.
Why would I want to consider something like that?
Yeah, absolutely. And that's a great question because the two modalities to therapy, right? It's what's going to be the best fit for me.
Mm-hmm.
And so the reality of it is that both might be a really good fit for you. So when we're working in individual therapy, right, you're presenting for therapy by yourself with one therapist, and you're usually working on whatever goals that you set forth in your session, usually from the jump, right? We're working on goal setting with our therapists to see what it is that we want to work on. And those goals typically usually change too as you kind of continue throughout your therapeutic journey as an individual client.
Mm-hmm.
And therapy individually can look like you're working on skills, and then we're usually working on interpersonal process as well, so that we're breaking things down that are happening around us, and we're trying to really dissect it a little bit more so that things feel like they're resolved to a point.
Mm-hmm.
With group therapy, the really cool thing about it is that you're getting to still work on the same types of skills and the same type of process, but you're doing it with multiple people. So usually when we're in a group setting, everybody's a little bit different. And I'm going to go into the different types of groups,
Sure.
but what we might see is usually 6 to 8 clients in the group together.
Okay.
And sometimes there'll be one therapist leading the group, or sometimes we have co-leaders. So there'll be 2 therapists leading the group.
Mm-hmm.
And the purpose of having the 2 therapists is that, they can kind of work together and pick up on things because there are multiple people in the group. There might be a lot going on. Having 2 therapists to kind of gauge what different people are saying and kind of facilitate group discussion might be a little bit more beneficial.
Okay. So I guess what I'm hearing is that you have several people, several clinicians as well, helping not only teach skills, but also there's conversation that's happening between the participants.
Yep, exactly. So there's many different types of group, but so maybe we're working on skills like cognitive behavior therapy skills. Maybe we're working on breaking down our automatic thoughts. Maybe we're working on our core beliefs, and maybe we're working on changing those as an individual. But then as group goes on, what we're doing is we're talking this out loud with our peers. And so our peers might get to jump in and say, hey, I noticed that you said this. Maybe I can help you with that because I had a similar situation. Or maybe they can just offer feedback of what it is that they're hearing, put themselves into maybe a position that somebody else is experiencing with that person and say, well, if you were treating me this way, maybe I would feel this way about it. Right. So you get to kind of play these things out in a group setting that we don't usually get to do with our friends.
That's a really good point, because one of the things that was coming to mind when I was hearing you speak is this idea that I would imagine some of the people that are watching might be like, oh, individual therapy makes more sense to me because it's like it's really focusing on my own issues, and it kind of feels that the attention is on me. While in group, I would imagine somebody could be thinking, well, given that there's a lot of people, how much am I really going to benefit? But that what you just said makes me think like, wow, that there's that added bonus that you could never find in individual work. It always has to be with other people.
Yeah, exactly. And you get real feedback. Usually when people are presenting for group, the hope is that they're coming in with their vulnerabilities and they're willing to share and get some of that individual attention, but then that they're also willing to give back to their peers at the same time. And having that reciprocity, there's a lot of healing in that, because usually through helping others, a lot of the time too, we feel like we're helping ourselves.
I guess another thing that comes up for me hearing you speak about this is then how do you typically structure a group? I would imagine people have to have similar concerns that they're bringing up. I guess, is there like a screening process that some of the viewers can kind of think through whether they want to join one group versus the other?
Yeah, absolutely. So there are screening processes that different centers like ourselves might go through, in order to make sure that you're a good fit for the group. So we might have a dialectical behavior therapy group that would be more DBT informed is what we might call that, because we're not doing strict DBT maybe. So people are presenting with maybe a similar, we're looking for homogeneity, right, within group members. So just for example, say we have teenagers who are really looking to work on some self-esteem. A DBT group might be great for that because a lot of the skills that we work on in DBT also translate to self-esteem. And so we would get teenagers within the same age range. You want to try and be as close as possible. So if you're screening and you're a parent, you say, hey, I have a child who's between the ages of 12 or 15. You know, this is what they're presenting with. Maybe they're having issues with self-esteem and anxiety. Maybe we would say, oh, they sound like a great fit for this DBT group because these are the skills that we're working on. You can even break it down even further. Sometimes groups screen based off of gender. They'll screen based off of if anybody has a particular diagnosis that might be a better fit. It can be really, we want, like I said, we want to look for that homogeneity, but then there's also going to be intricacies because everybody's different at the same time.
And I would imagine having a little bit of variability is helpful also because you get some, you know, information that's being shared that's hopefully helpful throughout different presentations.
Yeah, exactly. Because some kids might have depression while some have anxiety, but we know as clinicians that there's a lot of overlap within that. So there can still be some help that maybe, you know, other teens can help their peers with, that maybe they're experiencing it in a different way. It looks a little bit different from a clinical standpoint, but there's a lot of overlap for them to be able to help each other out.
So is it common for people or clients to be in both individual and group? Because the way you're describing it sounds like, wow, I do individual work, but then group sounds like is a great way to do it because you talk about what's going on for you, you learn some skills, you process it, you put it into practice, and you get the benefit of other people giving you realistic, authentic feedback. While in individual work, nothing like that could even, you know, come close. So do people oftentimes do both? And if so, what do they typically do in individual if it sounds like the group work is, you know, relatively comprehensive?
Yeah, so it's a great question too. So a lot of times actually in the screening process, like we were just talking about, certain groups will actually require for kids to be, or adults, whoever's doing groups, they might require that they also have an individual therapist because there are so many benefits to group. Like you're saying, like you get this process for yourself along as getting feedback from other people and being able to work on interpersonal relationships in real time. It doesn't also give the benefit that we get in, you know, our individual therapy with our therapist. The nice thing about having both is that you have like your time for yourself. A lot of the time, as I talk about as a child and adolescent therapist, I always tell kids, this is a really cool thing. This is 45 minutes all about you, that you get to talk about all about yourself. And even as adults, people really like the concept of that. You know, this is your time to really maybe work on those skills, hone in on them a little bit differently, practice them. And maybe you get to also just get a lot more of that interpersonal process going on. Not to be said that the interpersonal process can't happen in group, but you really do see the benefits of both, of being able to work on it individually. And then maybe you're taking the skills you get individually and you practice it in group.
Well, I'm sold because even before this conversation, as you know, I don't do group, and that's like really not my specialty. But hearing you talk, it does make a lot of sense. So I'm really eager to see kind of how that plays out, and hopefully we'll get to start some groups here at the center.
Yeah, absolutely. I love that.
Well, guys, I hope this was helpful to you. You know, as you've noticed, we try to touch base about group therapy versus individual, and why would a potential client choose both or potentially only stay within the group dynamic. Thanks so much for watching, and we'll see you next time. Take care. Bye-bye.
Hey guys, if you like what you just saw, please feel free to check out our videos in our library and also hit the subscribe button so you can check out our future videos.